Hello and welcome to a special interview for The Wire. With coronavirus cases increasing by nearly 400,000 a day and deaths escalating by over 3,500 a day, there's only one question that most people want answered. How much worse could things become? My guest today is in a unique position to answer that question. He's been doing mathematical models since the very start of the pandemic last year. Joining me now is Professor of Physics and Biology at Ashoka University, as well as the Institute of Mathematical Sciences in Chennai, Gautam Menon. Professor Menon, let me start by asking you about the mathematical projections that you've been doing since the start of the pandemic. Tell me, do you have any sense of when this present second surge will peak?
Thank you for having me on the show, Karan. I think now most models suggest that you should have a peak somewhere in the month of May. We'd guess around the middle of May would be the best guess, and our models are no different. Where exactly within the month it'll figure what's the uncertainty on that number, we're not so sure yet. But the best guess would be around the middle of May.
So your best guess is roughly somewhere between the 15th and 20th of May, if I can put it like that. Would that be correct?
A little broader than that, maybe between about the 10th and the 25th of May might be a broader range.
Tell me something else. When this surge reaches its peak, do you have any sense of how many cases we're going to see each day, as well as how many deaths we're going to see each day?
So the cases we can be a little more sure of. In our models, we seem to think that between 500,000 to 600,000 cases per day is probably where the peak is at. This is a little more conservative than some other models which seem to look at 800,000 to 10 lakhs per day in terms of numbers. But that's where we think it is. With deaths, it's a little harder to say. Right now, we seem to be overestimating the deaths in our model. There may be several reasons for that. One is that because the health system is so overstrained, we're actually seeing people dying who shouldn't have died in the first place because they couldn't access proper medical care. We'll have to think about how to adjust those numbers in, as well as the fact that people are not appearing in hospitals when they need them. We're undercounting deaths, we're undercounting cases, certainly. So this leads to a lot of uncertainty around the death numbers. So I'd be less willing to give you an estimate for those. We don't know.
I take your point that you believe your model is overestimating death, but even bearing that in mind, can you give a ballpark figure of the sort of number of daily deaths when we reach our peak in the middle of May?
So I think one guess would be approximately double the number that we have. And that I think would be a reasonable estimate.
But, that means roughly
as 7, I said, I'm unsure.
That would be 7,000 a day.
Yes.
Now, at the moment, we're seeing nearly 400,000 official detected cases every day. The question is, how many more would there be that have not been detected? In a tweet that you put out last week, you said it could be as much as 20 or 25 times more. That would suggest something between 8 million and 10 million undetected daily cases. Would you stand by that calculation? And if you do, can you briefly explain how you come to it?
So in the models that we work in, we look at both the deaths and the number of official cases. And then we look at the number that would have been expected given that certain death rate and the uncertainties around it of the actual number of cases that are there. So the discrepancy between the cases that you detect and the cases that are there, the infections in the background, is roughly this multiplicative factor of about 20 to 25, as I indicated in my tweet. There are other methods of doing it which get numbers closer to 30. Some are a little more conservative and have numbers around 15. But I think a factor of 20 is consistent with our description of the previous wave, of the first wave of COVID in India, starting around February of last year and going on till about the 15th of February when the new wave started. So right now, things are a little more uncertain, and I'm prepared to admit that at this moment, you probably will have a number close to 25, a factor of 25 or 30 between detected cases and actual cases. But this rough ballpark figure should be correct.
So at the moment, your hunch is that range of between 20 and 25 times more would be closer to 25 times more, which means that the extrapolation that we have something between 8 million and 10 million undetected cases every day, that extrapolation is correct.
That should be correct, yes.
Now, Calculations done by Jamie Malik in the Hindustan Times just 2 days ago on the 28th of April show that the rolling weekly average of daily deaths has been increasing by 50% every single week for the last 4 weeks. In fact, he points out that in the last week, it increased by an astonishing 84%. He's also therefore calculated that the case fatality rate, which was as low as 0.7% in early February, has now shot up as per last week to 1.7%. So my question is simple. Is it now the case that the comfort that India used to take from the fact that we have a low case fatality rate no longer a comforting factor for us?
So that number has certainly gone up. But one question is whether this is really a temporary situation, just because the medical system and the health system is so stressed. Because people who would otherwise have survived are unable to get treatment in time, they die. And that's one reason why mortality figures are being pushed up. Of course, there's also a much larger question of counting the deaths correctly. What's the discrepancy between the number of official deaths of COVID-19 and the true number of deaths? And that may, in fact, be a much larger sort of gray area that we don't know enough about. But at this point, I think at least the official numbers are probably a little higher than they ought to be because of this fact that people are unable to get medical treatment at the time that they want it, unable to get oxygen and so on when they want it. And this is the result for the current rise in the case fatality rate.
So does the conclusion that I drew out of Jamie Malik's calculations hold? That the low case fatality rate, which gave us so much comfort during the first surge, is not as comforting in the second?
It's gone up, but I don't know how long this will last. And it presumably, over a somewhat longer period, one might expect it to come back down again. At this point, it's difficult to say. It's certainly not anything intrinsic as far as we believe to the virus itself. It's just the fact that our medical system is unable to cope with the large number of cases that have struck it.
Now, there's another extrapolation that one can draw from Jamie Malik's calculations, and this time it comes very close to what you said was likely to be the daily count of deaths when we reach our peak. You said the daily count of deaths when we reach our peak would be double the figure of today. Today's figure is 3,507, which suggests the daily count, as per your projections, is likely to be 7,000 deaths a day in the middle of May. Jamie Malik approaches that a little differently. He says that if one accepts that today we are growing at nearly 400,000 cases a day, and if one accepts that the case fatality rate is 1.7%, then 2 weeks from now, we will have something like 6,500, 6,600 deaths every single day. That's very close to your figure, isn't it? This is another corroboration of your figure.
Yeah, but I didn't want to put such a precise number on my figure. That was just a sort of number off the top of my head, because, as I said, there's a lot of uncertainties in this. And I suspect now that cases will begin to taper off a little bit. If they're to turn around the middle of May, you should see a slowing down. You should see a little less pressure on the hospital system going forward, if these ideas are correct and if that's where you expect the turn down. So the situation may not be as dire as he predicts by that time, even though I quoted a number for you. It may be a little better than that going forward.
Except that the slowing down will happen after the cases peak. Because till the cases peak, not only will cases be rising, but consequently, so will the absolute number of deaths be rising every 2 weeks. But once cases peak and start declining, then deaths will also decline, although that depends upon the speed of the decline. We don't know as yet how quickly the decline will happen.
So one thing you should note is that the decline in the deaths will lag the decline in cases. So if you expect a rise in cases, a fall in the cases by about the 15th of May, then you will see the peak in the deaths about 2 to 3 weeks after that. So it's a bit hard to say what might happen then. Much of the country is under lockdown at the moment. So what happens in terms of reducing the number of cases that we'll see in the next 2 weeks, which will then reduce the number of deaths that one might see after that, is a bit unclear. So this is, I think I would not be as dire as that particular prediction. It probably is on the lower side, is the number that I would prefer.
Now, there's one more question I want to ask you about deaths. Officially, the Indian government says that the number of people who have died since the start of the pandemic is just below 210,000. I think I'm right in saying that absolutely no one in the country believes that figure. Most people think it's a gross underestimation. Some people say it's an unimaginable low estimation. Now, in Europe and America, to get around similar sort of problems, they work out what they call excess deaths. And that leads you, at least in their case, to a better understanding of the number of deaths attributable to COVID. Is there a way we can work out excess deaths in India? And if we can, what does it tell us about the total number of COVID deaths?
So the difficulty with doing that in India is just the fact that we don't have records of, although we have 80% of deaths are registered, in only a small fraction of them do we have the records of why they died, in the medically certified cause of death. So to find out who died of COVID versus who didn't, it becomes a lot harder. Most people in India die at home. So to figure out what those numbers are in a non-COVID year to see what are the sort of errors at there, and then compare it to the numbers in the COVID year would be the right way of doing it. I worry a little bit about uncertainties in these numbers and the fact that there are many competing things. For example, there have been much fewer road deaths as a consequence in a year that in last year, certainly we saw many long-term shutdowns and lockdowns across the entire country. So how do these factors compensate for an overall increase in deaths from COVID is yet unclear. And this is going to be things that people will work out for the next several years to figure out, to try and understand what these numbers are. It's a bit hard to do this in an evolving situation at the moment.
Let me put this to you. The same problem about road deaths coming down would have applied in England and America during their lockdowns as well. It's not unique to India. And yet, people in Britain and America found a way of accommodating that and still calculating excess deaths. Are you suggesting that we in India, for a variety of different reasons, cannot accommodate these sort of problems and therefore cannot come up with a calculation of excess deaths? Is that what you're suggesting?
No, I'm not saying that. I'm saying that this is certainly something that we could do. One might have to wait a little bit to see what the situation is as the data comes in. There's always a lag between data coming in and your ability to look at it. So it's certainly something that we can do and we should do. There are uncertainties surrounding this, but there are statistical methods to take care of this. So this is something that we ought to do to really figure out what the impact of COVID-19 has been on India.
Very interesting, the words you used. It's something we can do, should do, ought to do. The question is, are we doing it? Have we done it? Have you done it?
So we haven't done it. And there are sort of surveys that try to understand the discrepancies between official numbers and actual numbers. There's one way of doing it is just to look at the difference in the counts between, say, crematoria and burial grounds and official numbers that are put out. There is a study based on the Consumer Pyramid Health Survey, which targets a certain large group of people and asks, has there been an excess of deaths in that particular population? And that sort of suggests that there has been a substantial increase of deaths overall that have gone unrecorded. We'll have to look at multiple ways of integrating data like this, multiple approaches, to see what is happening. But right now, I don't think we have an idea nationwide of what that factor might be. Okay. We have a rough idea from the models that it's probably somewhere between around 2.5 to 3, let's say, as a rough estimate.
Undercounting. What is around 2.5 to 3? The excess deaths?
The multiplier between the actual recorded deaths and the true number of deaths. Okay. That comes from a modeling estimate, and it's somewhere between 2 to 5 would probably be a better range. And if you want a number, it would be around 2.5 to 3.
Okay, but as you said, this is something that we can do, ought to do, should do, and hopefully someone will do, and we wait till that someone does it. Let me come to another issue. Mutant strains. To what extent do you believe are the mutant strains largely or substantially responsible for the second surge we're experiencing? And I'm talking primarily about the British variant as well as our own double mutant found in Maharashtra. To what extent are these two largely or substantially responsible for this present surge?
In my opinion, they're almost completely responsible for the present surge, because if you look at the background in which they happened, the very, very sharp rise in which they occurred, together with the observation of increasing numbers of patients with these strains in both the north of India, in Punjab and Delhi, which is the UK strain, the 117 strain, and the Maharashtra strain, the 617 strain, you can see that these numbers of this particular strain of virus has increased, of the variant has increased across a period of about 2 months. And the very sharp takeoff of cases suggests that something new must be at play. So it's my feeling that variants are really driving this increase in cases, but the story is varied across India. There's a different variant that is dominant in South India, a different variant in the north of India, one for the east, one for the west. So the picture is overall far more complex, but it's certainly true that variants ought to be driving much of this and not anything else.
Can I ask you, to speak a little louder, Professor Menon. From time to time, your voice drops, and I would hate people to miss what you're saying. Let me put an alternate view to yours. You began your answer by saying, in your opinion, the mutant strains are almost completely responsible for the surge we're experiencing. However, just 2 days ago, the British paper, the Financial Times, published an article quoting some very eminent British scientist experts, including Sharon Peacock, who's the head of Britain's genome sequencing. And they've concluded, and I'm quoting now, there is little hard evidence about the virulence and transmissibility of the variant. In other words, they've told the Financial Times that it's not variants that lie behind the terrible surge India is experiencing, but large gatherings like the Kumbh or political rallies, lax COVID behavior, as well as the inability of the health system to cope with the crisis that's building up. How do you respond to that view, which is very different to yours?
So I think all of the additional, the crowds building up, the Kumbh Mela, all of these are contributory factors, and they're all very important. Had they not been there, we would not have seen the surge of cases that we're seeing now. I disagree with what they say I agree with what they say about virulence, because as far as we can see, the strain is as virulent as the earlier strain in terms of deaths. It's not leading to an excess of deaths, particularly compared to the earlier original strain of virus. However, it is more transmissible, and this is certainly true from across multiple studies across multiple continents. It is a more transmissible variant. It contains within itself the mutations that allow it to attach better to cells and therefore infect them better. And it's hard for me to see any other explanation other than transmissibility, together with, as you said, all of these, the increased crowding, the lack of appropriate COVID behavior, all of these come together.
Okay. I will, for the sake of the audience, point out that it's not just this article in the Financial Times that claimed, quoting British experts, that the strain of the virus was not more transmissible and not more virulent. There was also an article in the New York Times yesterday by their chief of bureau in India, Jeffrey Gentleman, which also quoted experts, I think American experts, who also came to a similar conclusion like the British ones. You're disagreeing with both. Let me now focus on two areas of particular concern at the moment, Delhi and then Maharashtra. Let's start with Delhi. There was a report in yesterday's Hindu newspaper that the virus may have passed its peak in Delhi because for 8 consecutive days, the positivity rate has been below the peak it reached on the 22nd of April of 36.2%. Do you accept that conclusion, or do you think it's pretty premature?
No, I think Delhi has a way to go. Delhi is still seeing test positivities in excess of 30%. So I wouldn't, and its testing has been fluctuating. In general, across the country, testing has not kept up with the surge in cases. So I would think Delhi still has a bit of a way to go before we can say that anything is turning around.
Let me then come to Maharashtra, which is in many senses India's most worrisome state as far as this COVID surge is concerned. For 15 or 16 days, Maharashtra has been steadily growing in what I call the range of the 60,000, roughly between 60, 61 at the low end and 68, 69 at the top. But it hasn't actually crossed 70,000 for roughly 15 days. Similarly, Mumbai, the capital, has been steadily declining and now is growing under 5,000 cases a day. Does this mean that Maharashtra, the state, has stabilized and plateaued, and that Mumbai, the capital, is actually steadily improving? Or again, is that an over-conclusion?
No, I think now we can say that the situation in Bombay and Maharashtra is definitely improving, it's definitely turned around. And our own model suggested that this might happen around the 20th of April. And it's interesting that we've seen a sustained downturn, and I hope it looks as though one can be more positive, cautiously more positive about the situation in Maharashtra.
Can you just spell out, you said your own model would suggest that around the 20th of April, it would turn around. Were you talking about Mumbai specifically or Maharashtra?
About the state, about Maharashtra, including Mumbai, overall, that we would expect a change.
So Maharashtra, you expected a change on the 20th of April, which means it happened roughly 10 days ago.
Yeah.
So therefore, both Maharashtra, the state, and Mumbai, the capital, have been declining for the last 10 days.
The situation has been improving. It's complicated by the fact of testing, which is not particularly homogeneous, and you're still seeing fairly substantial test positivity. But overall, I think the situation is improving in Mumbai, and I look forward to seeing what's going to happen in the next week to 10 days.
My last question. One possible reason why Mumbai and Maharashtra both turned around the 20th of April could be, I'm only guessing, the fact that Maharashtra imposed a fairly stringent lockdown, which was fairly well observed. And therefore, my question is this: given that your own mathematical forecast suggests that India by the middle of May could be seeing something like 500,000 to 600,000 cases a day, do you think we need a long duration nationwide lockdown? Or is the present system of short duration regional lockdowns sufficient?
In general, I'd be more in favor of regional lockdowns because I think states have a better idea of which areas to lock down and which to keep open. I'm not in favor of a nationwide lockdown at this point. I think the costs of that are too much and it's too inhomogeneously distributed across the country. I think what we need to do is to enforce lockdowns in a better way. And rather than lockdowns, you might use the word containment in a better way. Have more seriousness about it. There's some part of it that's just, in a sense, theater, night curfews and so on, which really don't make any difference. What you need to do is to make people crowd less. You need to think very much about ventilation. You need to avoid people in small enclosed areas with bad ventilation. You need to enforce masking as far as possible, including even potentially masking at home. Okay. People who, and so these I think are more important going forward.
I thank you, Professor Menon, for this interview, and in particular, I thank you for honestly and perhaps even bluntly answering that question in the introduction. How much worse could things become? Your mathematical projections suggest that this present surge should peak somewhere in the middle of May. You said that range of dates is between the 10th and the 25th of May. You said at that point, we could be growing somewhere between 500,000 and 600,000 cases a day. When I asked you what would be the daily death count, you were less willing to answer because you said it was more difficult to calculate. But in the end, you came down to a ballpark figure of roughly double what it is today, which would suggest 7,000 a day. I thank you for that answer. I thank you for clarifying issues that are understandably matters of great concern to the audience. Take care, stay safe.